to give you an update for our Chicago WZCC chapter, what we are doing and how we are getting involved at the global level. So this is our second WZC event on Zoom link that we have established in collaboration with all North American WZC chapters. Therefore, we have with us Mr. Rustam Engineer from Texas. And thank you, Rustam, for being here. Now, our joint project of making face masks that we have started with the WZC Women's Wing, with the collaboration with ZAC COVID Task Force, led by Zenobia Tantra, and that project is still going on. If you are still interested, looking for handmade cloth masks, reusable, washable, please let us know. We thank our volunteers, Roshan Ravetna, for making cloth masks and task force members for delivering those masks. I had mentioned to our last month meeting at Women's Wing of WZC, we are looking for 2 or 3 women volunteers to work with us where we may cite the amazing opportunities in the supply of food items. We can work on finding an outlet where we may sell Parsi food, fast food items. So please let me know if anybody is interested. Secondly, our WZC Chicago chapter have sponsored 4 youth from our community to participate in remote youth entrepreneurship program. I heard that they are really enjoying the program and the program is going very well. Thirdly, we are working on to be a part of WZC app at the global level, WhatsApp app. The new app will help our members in communicating and building meaningful partnerships with other chapters members internally and globally. So I like to bring to your attention that at WZC global level, there are lots of opportunities in coming up to develop Zarathustri entrepreneurship at many different levels. If anybody wants to know, if they are more interested in knowing about it, please contact myself or any one of us or Mr. Rohington Ravetna because he has lots of information. Therefore, I'd like to invite you all Chicago members to become our WZC Chicago chapter member. Membership dues are only $50 per year. And I don't want any one of you to lose these opportunities, these benefits that we are giving away with the global chapter. Now, the last thing that you must have all seen, this email, that's the email blast, for which we are very thankful to our ZAC members because he does the email blast all the time for our WZC programs. And this is the project that we have taken now, we are doing it right now. It started, it's a North American Youth Business Plan competition. And all community youth ages between 18 and 24 years old from North America are invited to participate in this. It's sponsored by our chapter. The purpose of this competition is to foster the spirit of entrepreneurship in our community. So all the details are given in this email. It must have come to you on July 12th. So please read it carefully. And if you know any youth aged between 18 and 24, please encourage them to participate. So now it will be a good project for them. Now, lastly, I like to introduce our very well-known guest, Dr. Dolly Dastoor. Dr. Dolly Dastoor is a clinical psychologist specializing in the assessment of dementia. She is an assistant professor in psychiatry at McGill University and chair of the Education Committee of the McGill University Research Center for Studies in Aging. The Education Committee is responsible for organizing a public lecture series, The Brainy Boomers. Before coming to Canada in 1973, Dolly was a senior research fellow with WHO at the University of Ibadan in Nigeria. In Canada, she joined the Douglas Hospital in Montreal in their geriatric services and developed the program in dementia with psychiatric comorbidity and was a clinical administrator and co-director from 1998 to 2013. She has published extensively on dementia and caregiving. Dolly was the founding president of the Alzheimer's Society of Montreal and vice president of the Alzheimer's Society of Canada. With her colleague Dr. Martin Cole, Dolly developed the hierarchic dementia scale, which is widely used for the prognosis of dementia. So please, I just wanted you to let you know that if you have any questions, please put it in the chat section so that Dolly will answer at the end of the presentation. Now, today's topic is, if you forget, is it Alzheimer's? And so please join me in welcoming Dr. Dolly Dastoor.
Thank you very much for Mani and the Chicago chapter for inviting me to this talk, because I think it's very important for members of our community, especially, to be able to know what the dementia is, what Alzheimer's disease is, how we should prevent it. We really can't prevent it, but how we could manage it in somehow or the other. Because memory is really most crucial to our consciousness, and we are all very afraid that are we losing our memory when we forget something, because memory gives us the meaning to our past. We are able to relate the past and bring it to the present, and memory is something which helps us to look forward and work towards the future. And so the present is just a concept, a construct. So we are so worried that every time we forget something, every time we lose our keys, so we can't find our keys, or we can't find our car in the parking lot, or if we cannot come to the kitchen and to look for something, and then you forget what the hell you came here for, and you have to go back to your back place and then find it. So memory is really a very important part of our psyche. It gives us the meaning, as I said, and as we begin to age, all things change in our bodies, you know. But there are some changes. We age from the day one. The day we are born, we start aging. And so when we have these positive changes going on in our bodies when we are small, when we grow up, when we are teenagers, they are good changes, we're happy changes. But as we reach our 5th and the 6th decades of our life, we begin to notice changes we do not necessarily look forward to. If you're late for lunch, you spend 10 minutes looking for your keys, you go to the kitchen, as I said, and you forget what you went there for. You bump into a friend at a social settings and you can't just remember the name, who the person was, you know, but you remember the face, but you can't remember the name. I mean, all this sounds very familiar. And if it happens to all of us, you are not alone. It happens to all of us. Memory slips up tends to occur more frequently as we age, and often create worries that maybe we are getting the big D, or maybe we're getting the big A, and the Alzheimer's is lurking around the corner. But while these signs are disconcerting, they're not necessarily signs of serious trouble. Instead, memory lapses are quite normal as we grow older. And while aging is inevitable, we age from the day we are born, memory lapses are not necessarily a necessary part of aging. There are steps we can take to preserve our memory and even improve the memory as we go along. But first, let us see what is memory. And memory is not something which stays in your brain. It's in one part of your brain, and you can say, yes, you don't see the brain, you don't see memory. You open up your brain, if you have a brain surgery, there's no memory located anywhere there. So what is memory? Memory is a Greek word which means memory, from the word, I can't even pronounce it, Mnemosyne. And it is a dance of chemical, and electrical activity in the brain. In the brain, there are billions and billions of cells, and they all talk to each other. And they talk to each other through synapses, where there are chemical exchanges taking place. And there's electrical activity taking place in the brain. And that is the normal process of how memory is formed. And there are different memory systems. What we call explicit memory, which is a declarative memory, which is where you have to consciously make an effort to remember something. For example, you have to make an effort for any events which took place in your life, you have to remember that. And that declines with age. As we grow older, we tend to forget the things which happened in the past because we don't encode it very well. We don't keep it very well. And then we have a declarative memory, or a memory with an effort for semantics, that is for words, for facts, for images of any learnt material. And that does not decline with age. As we grow older, we don't lose our language, we don't lose our vocabulary, all that remains. So all that is learnt material, and it does not decline with age. Not opposed to, but parallel to the explicit memory, what we have called implicit memory, which is non-declarative memory, where you don't have to make an effort to remember, and that does not decline with age. That is what we call procedural memory, where we have learned how to dress ourselves, how to drive our car, how to do the bicycle, or all the motor skills which we learned. And these are all automatic actions. You don't have to think that, well, am I going to do this first, or am I going to do that first? It's all automatic. And that is a non-declarative memory, procedural memory, and it does not decline with age. So we have to remember that everything with memory does not decline as you grow older. Some things decline and some things don't. So the next question is, how do we form our memories? Just as if you keep repeating the same thing again and again, there's the connections between the cells get stronger and stronger, and each experience makes a little more pathway in the brain. Just as you're driving on a road, which is a dirt road, and you keep driving on that, the same thing day after day, a pathway is formed. And that is how the strength of the memory is formed. Also, the memory, there are different types of memory. What we call sensory memory, primary memory, and secondary memory. Sensory memory is that what comes in through your ears, through your mouth, through your smell, your touch, all that is what comes through your senses. And that does not decline with age. There's no loss with age of that. It's all modality specific. Then when something comes from what I'm speaking just now to you is coming through your ears and through your vision. And if you want to remember that, you have to put that information into your short-term memory, which is called you can call it the short-term memory, it can call the primary memory, it can also be called the working memory, because use that amount of memory to be functional in your environment. And that is a minimal loss with age, because if you don't encode well, whilst I'm talking, if you're thinking of something else, if you're thinking, what am I going to eat after I finish here? When am I going to bed after this? You're not encoding, you're not taking in the information which is being synced, so that doesn't sink into you. And that, unless you have a properly encoded memory, that short-term memory will fade very quickly. Another example of short-term memory is when we had the telephone books and we were looking up telephone numbers. Now nobody looks that up. We have our smartphones, so we don't even have to do that. We have outsourced it. So when you're looking up the numbers, you phoned, and the number is gone. You don't have to memorize that number in your brain. So that is a short-term memory. But if you want to remember something for even a longer period of time, if you want to remember it for a day or two, if you have some exams in the next day and you have to remember something, then you have to learn, you have to try to repeat that information again and again several times over several days so that it remains in your memory and it becomes long-term memory. It becomes more fixed in your memory. So the relationship between the primary memory, which is the short-term memory, and the secondary memory, which is interactive, is very interactive. One goes into the other. And the recognition is better than recall. Sometimes you cannot remember something, but you can, if some things are shown to you, you can recall it and say, yes, that was the thing which I was looking for. The recall is not as good. I mean, recognition is much better than recall. And something which you see visually, you remember things much better than what you hear. If you can only hear something, you don't remember it as well as if you can see it as well. So in the days when we had no PowerPoints, when we had no visual things going on, and we were only taking notes from our lectures, we could not absorb everything. But now with both things together, visual and auditory, you can remember things much better. So this is just a model. You have a working memory which declines very quickly, and then it goes into immediate memory, and in short term, that remains in your thing for about 30 seconds to about several minutes. And then it goes into your long-term memory, and then the long-term memory can go indefinitely. It has an unlimited amount of time and unlimited amount of space in your brain to keep that memory. So why does the memory decline with age? So there are areas which in the brain which are vital to memory. The most important is the hippocampus, and okay, this thing over here, this blue thing is the hippocampus, and that's it. What is the wire where when your memory, the image of the memory rests there, it goes into there, and is processed there, and from that it goes to different parts of the brain to be used for whenever it is necessary. It goes to the frontal part of your brain to be able to, when you needed something information, the hippocampus pulls it out from there. The other part with the hippocampus is very closely associated with is the amygdala, where all our emotions reside. If an event is a very joyful event, if an event is a very sad event, that stays with the hippocampus and the amygdala. So all that goes together, and it's very important that we preserve the integrity of the hippocampus. And then you have the thalamus, which controls your attention. And as we grow older, that attention, when we were younger and we had our children and if little babies, and if somebody cried there, you would jump up and go and to see what's happening. But now, if you have a grandchild or little child coming in your home, you don't jump up and go, you leave the parents to do that thing. So that's the difference. We don't pay enough attention. When we pay attention to something, you remember that things much better. So the activity in the hippocampus, as I showed you, at the frontal lobes, which are here, slows with age. That is due to the loss of connections. As I said, the synapses don't talk to each other as much. The chemicals which are there slow down, and the speed with which they pass through is just not there anymore. So that's the hippocampus I showed you. Okay, so how do we preserve our memory? There are different ways to which we preserve our memory. One is lifestyle changes. One is, let me see, lifestyle changes. Then let me go back. Lifestyle changes. They say that our lives, the length of our lives and things depends much more on how we live. And how in the lifestyle changes, we have to have cognitive attitudes, a positive attitude, and the use of efficient strategies to be able to keep our brain active. In lifestyle changes and how to preserve memory, the most important is exercise. And I can't emphasize that enough, that how important exercise is, not only for your body, because we go to do gyms and do presses and you go do the Nautilus or do all sorts of things, but the exercise is as important as for your brain, because the exercise increases your circulation, and the more the good circulation there is in the brain, the better your brain will function. So if you have to exercise both for your mental exercise and your physical exercise, and if you exercise 30 minutes a day, a minimum 30 minutes a day, 3 times a week, that should be pretty good. And also, I would suggest that when you exercise or when you're walking, and walking is a very good exercise. And if you're walking, go walking with somebody else or do with somebody, other person, because that creates your socializing, you're talking to somebody, you're doing something with somebody, and so you're exercising both your brain and your body at the same time. So exercise is good. Exercise could be just walking exercise, could be balancing exercise, could be weightlifting exercise, all sorts of things to maintain your body structure. The next thing in your lifestyle, which is important to maintain a good brain, preserve your brain, is diet. What you put in your mouth is what goes into your brain. So this depends on what you're eating. A pro-memory diet, which is low in saturated fats, which is high in fruits and vegetables, is very good. You have to have a lot of vitamin B12, folate. Nobody likes to eat that. We never like to eat spinach, but spinach is very good. Citrus fruits are good. Asparagus is good. And beans are good. And beans, for us Zoroastrians or Parsis, we eat a lot of kathor, and that's very good for us, and that we never knew that we all the time we eat kathor, and we eat every second day. We used to have pasur or chana nidar or something of the sort, and that is good for your brain. Folic acid, vitamin E is good because that contains nuts. Nuts contain vitamin E, oils, and then it protects the brain from aging. So you should take some vitamin E supplements, you know. Another important thing for our lifestyle is sleep. It's very necessary for us to have at least 8 hours of sleep. I mean, we say at least 8 hours, but many of us don't follow that. And I know Kitayun is smiling, but I know that she and I, we don't follow that 8-hour sleep business, you know. And because sleep, sometimes we feel that the sleep, but you're very tired and you go to bed and you think that, oh, sleep is necessary, my body is so aching. But the sleep rejuvenates your brain as well. The whole day, your brain has been active. It's very active in doing things. And so when you're sleeping, the brain rests. And when it is rest, it recuperates and it repairs all the other things which are happening in the brain. The body has an inbuilt mechanism for brain repair. And by sleeping, you repair your brain. Our brains are not meant to function continuously for more than 16 hours. And that's why when they torture people, they deprive them of sleep, you have sleep deprivation, and that your brain just does not function after that. Everything is got for 8-hour shifts, or sometimes maximum 16-hour shifts, not more than that. And it is said that this generation is the most sleep deprived generation. We sleep much less than what we should be sleeping. Our children also don't sleep as much as they should. And so it's a sleep deprived generation. We should sleep much more. The other thing which is useful for our lifestyle is stress, to manage stress. I mean, there's nobody in this whole world who's without stress. We all have stress, but how we manage stress is very important. Because when you're stressed out, you have a higher enzyme called cortisol, which is a stress hormone. And when you have more of that thing, which functions in the hippocampus, and it shrinks the hippocampus. So what happens, if you must have noticed yourself that when you're very stressed out, or when we were in exams, or we had to go for an interview, you're stressed out, you can't remember things. And then because the stress hormone, the cortisol hormone, acts on the hippocampus, which is close to it, and they interact and you forget. And when the stress level comes down and you come out of the examination or you come out of something, you say, oh my God, I knew that. How come I didn't forget? I just forgot. I just couldn't remember. I went blank. You go blank because that cortisol is so high in your hippocampus. So you have to learn to control your stress, which is easier said than done. But if you have enough time, we'll talk about how we can manage to control our stress. And the last thing, which not last, but one of the more important things, is social and leisure activities. What we're doing now with COVID, everybody is involved at home, but we are having all these Zoom talks and we're doing things, and we're still maintaining our social. We don't have to have the physical distance is not there, but we are maintaining our social interactions. We are maintaining our leisure activities. So social and leisure activities are also quite important to be able to maintain a good functioning brain. People who are homebound, people who are lonely, do not have as good a lifestyle, or do not have that good a lifestyle as those people who are surrounding with people and with families, and associations like ours, when they have activities and bring people out, that is very important for our community. Okay, the other thing in lifestyle measurement is maintaining a good body weight, monitoring your diabetes and a good glycemic control, maintaining your physical health, controlling your hypertension, taking your medication, and controlling your osteoporosis, because that gives you your balancing also. So good physical health and good exercise, all that is helpful to preserve your memory. Then the third part of it is your cognitive activities. You have to keep your brain active. You have to try to learn one new activity a year, something which is active, not something passive. You can say that, okay, I'm looking at the television, that's that's one activity, but that's a very passive activity. If you want to watch the television, watch with somebody else so that you interact, and you talk, and you discuss, and you get excited when you see something on the screen. So learn an activity a year. Other thing is efficient strategies. We have to develop some strategies to remember things. We have to develop an internal memory strategies and external memory strategies. Now, the external ones are very easy because we have our agendas. Now we have our Google systems. We have a filing system, writing things down. All that we have outsourced our memories to so much. We have outsourced to our smartphones. We have outsourced it to our radios, not radios, what we call this is cameras. We can take as many pictures as we want and erase as many pictures as we want. We don't have to be worried about anything else. You know? So all those are external memory aids. We have our post-its. We put little things on our agendas. We even have electronic post-its now. So everything is all more organized. And internal memory aids are when you get a new information, you have to try and hook it up to something else you already know so that it becomes more stronger in your brain and you can remember those things better. Visual strategies, verbal strategies, you add some information to it, okay? Okay, so now when should we start getting worried that our memory is not as good as it should be? Now, sometimes when you go to the doctor and say that my memory, or you tell somebody else, I don't think my memory is as good, I don't remember it, they say, oh, don't worry, you're just being worried. This is also called worried well. People who are well but keep worrying about themselves. But there are some signs, little warning signs, which you should be a bit careful about. The first one would be, there are 10 signs I'm giving you, but they're not necessarily in any order. Memory loss that affects day-to-day function. Some things which you were doing regularly, which was very easy for you to do, you don't do it, you keep forgetting to do it, you know, or you don't know how to do it, you know. 1 second. Okay, and you forget more often. Then the second one, okay, is difficulty performing familiar tasks. The things which you were doing, the recipes you were cooking always, you forget, you have to keep looking at it, or you even completely forget. A very familiar task which you are doing, you know, sewing or shaving, things like that, difficulty, very familiar task you have. You may not have difficulty all the time, but sometimes, but that happens. Then another problem is, another sign is problems with language. You begin to forget to say the right word at the right time. This is also called the tip of the tongue phenomenon. You meet somebody and you say, as I said before, you know that person, but the name doesn't come out of your mouth. If you want to have an item and you want a pencil, but that word pencil doesn't come out of your mouth. You keep saying, oh, I need that thing to write with, or I need something which is like a pen. The word doesn't come out. So that's, you have problem with language. Now the language is not only speaking, but language is also writing, and language is also reading. So when you have problems with your memory, your writing becomes a little changed also. It becomes a little more difficult. You're reading, sometimes you keep reading the same paragraph or same line 1 or 2 times, and you come to the end of the paragraph and you forget what was in the beginning of the paragraph, and you have to go back to read. So that's a little problem we have to remember. Then there is what we call as disorientation with time and place. This happens, sometimes it has happened to me also, and it's quite scary. You're going down, you're driving, and suddenly you say, where am I going? Am I supposed to turn right, or am I supposed to turn left? And it may be for a very split second, it may not be for a long time, but it happens. And if it happens more than once, then you have to be a bit more careful. Because disoriented, okay, one would say that I'm retired now, I'm at home. Why should I be worried about time? Why should I be worried about where I am? It's all the same. And now with COVID, every day is the same. Everything is merging into each other. All days are the same, you know. So there is a lot of disorientation of time. But try to bring yourself to be cognizant of what day it is, where you are. Have a calendar where you have to change the date every day, instead of having a calendar with the big calendar which we normally have. And now I suppose nobody even has that calendar. It's all on your phone. So if you have, try to be more oriented, make a conscious effort to remember the time and the place as well. Then poor or decreased judgment. you don't make a good judgment. All the time we have to make a judgment of every day for every little thing. And sometimes we make very poor judgment, and that is more important when people have to make some investments, or the people are richer. Poor people may not have that problem, but people who have to make some investment and they make wrong investments, they do some wrong things, make wrong decisions, and that causes a lot of problems. So poor and decreased judgments is important. Problem with abstract thinking. When we do things, we don't normally have to have this item in front of us. If we have to write a check, or if we have to write something, we don't have to have the checkbook in front of us to be able to know what we're supposed to do. But with abstract thinking, unless you have that item in front of you, you will not be able to do anything. So when that problem starts, you have to be a bit careful. Misplacing things. We all misplace things. They say that we spend at least 1 month a year trying to find the search for things which we cannot find. You think you're looking for something and it's completely in a different place. So that it's all mixed up in your head. So misplacing things is very common. And when that happens more than once, be careful. Changes in mood or behavior. Now, this is also something which we have to be careful about. People who are really calm, not getting excited, they have a very smooth, nice behavior, suddenly start becoming angry for no reason. They start becoming anxious for no reason. That's another sign of a warning sign of a decreased memory. Changes in personality, this goes together, the mood and the personality go together. The loss of initiative, because when we want to do something, we have to, when we get up in the morning, we have to plan something that, okay, today I'm going to do X, Y, and Z, you know. But with beginning to have this decreased memory and decreased problem, you lose initiative. You don't want to do anything. You want to just sit down, be in your pajamas the whole day, not do anything else, you know. So there's a lot of it. You tell them, why shall we go to a movie? No, you go, don't want to go. Okay, so now these are the 10 warning signs. If they become more stronger, they may turn into dementia. So I want to talk a little bit about dementia, and I want you to tell me, or tell yourself, is there a difference between dementia and Alzheimer's disease? Some people think that they are the same. Some people think that, oh, no, they're two different. I would have patients come to me and say, my mother has got dementia. She doesn't have Alzheimer's disease. Or they'll come and tell me the opposite, that, oh, the doctor told her she has Alzheimer's, but she doesn't have dementia. But the thing is that dementia is an umbrella term which covers 64 different types of diseases, of which Alzheimer's disease is only one. But it is most important of all the. So dementia is a syndrome. That means it's a group of symptoms which results because of loss of structural loss and death of cells in the brain. It has got nothing to do with age. I have had people who have problems with dementia or problems with Alzheimer's disease who are as young as 40 and 45. And I've had people who are as old as 90 and they're well. So there's nothing necessarily to do with age. But age is a factor, but this is not a necessary concomitant of aging. And how does it start? It starts with a very insidious onset. It starts very gradually, that you don't even know what's happening. You feel that one day you forgot something, another day you forget something. It doesn't matter. When you ask the family, when they come to when did this start? She says, we don't know. We can't really pinpoint when it started. There's no fixed point. It's very gradual. And it is a progressive decline. It is not something which stays stable after a while. It is something which goes down continuously. It's a decline. And it destroys cognition, thinking. It destroys your function. And it also destroys your behavioral abilities. We always think of dementia and we always think of Alzheimer's disease as only something which affects your memory. It's not only affecting your memory, it affects your behavior. As the dementia progresses, your behavior becomes more and more difficult. And those of you who have had knowledge of people who have lived with people with dementia will realize that they become aggressive, they become wandering, they become agitated, all sorts of things. Now, there's a young lady in California. Her name is Zina Sarkari. She's written this very nice book, and we had even reviewed it in the Fazana Journal, of her experience with her grandparents her grandfather rather, and how her grandmother looked after him and how the whole family looked after him. And she's written a very nice book. If you can get a chance from your libraries, do buy it and do read this book. Okay, then less than 10% of people who experience these short lapses of memory, which I spoke to you about, only about 10% develop dementia. Rest of them are quite all right. Hopefully, most of us will be all right. But so even before the symptom starts or detected, there are plaques and tangles are formed in your brain in the areas which manage learning and memory, which manage thinking and planning. And it starts at least 5 to 10 years before. So you really don't know, just like you have your silent people who carry the symptoms over here for COVID, the same thing over here. You carry the symptoms and you don't know that you're going to get dementia symptoms. So it's at least 5 to 10 years before the symptoms starts. And what are the symptoms in dementia? First thing is memory impairment. So that is why everybody is very careful that we have to preserve our memory. Memory is the first thing which begins to show. The other things which show are cognitive impairments, which has language functions, executive functions, apraxia, agnosia. Now, the deterioration which takes place in dementia or in Alzheimer's disease is the reverse of how the development of our child takes place. When a child is born, the child, there's no sound, there's only sound, it cries, it has no verbal, not words are not formed. But as the child develops, words are formed, they begin to say one word at a time, mama, papa, or whatever, and he points out to things which they want, and that's how it begins. And then you begin to have sentences, you have a paragraph, and the whole thing takes place. In the beginning, the child just scribbles, it doesn't write, and then the letters are formed. And when the dementia is full blown, what happens is the ability to speak deteriorates and deteriorates and deteriorates until the end, nothing is spoken. And the handwriting also keeps changing. In the end, you only scribbles. So you see, there's a very parallel development and deterioration between the development in our human body and the destruction with dementia. Executive functions are what we have to decide that, yes, this is what I want to do. This is what should be done, should not be done. But all that element becomes lost. Apraxia is when we do things with our hands, when you dress yourself, when you put your shoes on, when you brush your hair, when you shave or do whatever you want to do, cook, you're doing using your hands. And with dementia, that ability, that flexibility of doing things with your hands is lost, or it deteriorates slowly. Agnosia is the ability to recognize objects and know the meaning of objects. With dementia, as the dementia progresses, you lose that ability of recognizing what is what. I have had patients who would come into my office and look at the waste paper basket and think it was a toilet seat. And they would sit there and do their business. So they forget of things. I used to go to do home visits, and they used to go to a lady who was a very young dementia patient. We'd go to the toilet, she'd stand in front of the lavabo, the wash basin, and she wouldn't know what to do, how to open the tap, what's to be done, how is to be opened. And once the tap is open, what should be done with it? The water is coming out, you have to wash your hands. That ability to recognize what you're supposed to be doing is lost. Then you have the functional loss, you don't function very well. But in all this, your consciousness is clear. You're not confused, you're not lost, and there's no depression. You're not depressed at this time. Everything is clear. So what is the prevalence of dementia globally? We have to be scared, because in year 2000, there were only about 20 million. By the year 2050, there'll be 131.5 million people. Now that's a hell of a lot of people. How are we going to manage this? That is a very important question. After which 61% of the people who will get dementia or Alzheimer's disease are women. Ladies, be careful. And 39% are men. So it is somehow or the others age-related, not age-related, sex-related. Now, as I said, there are different types of dementias. There are 60 different types of dementias. And the most common is the Alzheimer's disease, which is 64% of all the dementias are Alzheimer's. The next most common is the vascular dementia, where your vascular system, your blood pressure is not in control, your hypertension is there, and all those things. And when you have diagnosis of vascular dementia, at least you could control some of those factors and keep, as long as those factors are under control, your cognitive functions will remain under control. So vascular dementia is another important thing. Frontotemporal dementia is where the cells in the frontal area and the temporal area are damaged. And there is, it's a dementia where you become very open and you say things whenever you want to. There's no control. There's no, sometimes when you want to say something and you feel that, no, I shouldn't be saying these things. It's not the right place to say it. But with frontotemporal dementia, that control is gone. You say whatever you like, you say stupid things, or you say very lurid things to people, and that becomes very embarrassing, you know, when you have a frontotemporal dementia or somebody in your family. Then what we have in alcoholic dementia, which is now very much under control. When I started working, there were many more people with alcoholic dementias because we didn't take care. We didn't eat enough at the same time as we were drinking. So alcoholic dementia is a dementia where the most important feature over there is your memory loss. The memory is the one which, your language is okay, your judgment is okay, but your memory loss is gone, completely gone. And then what you have, what we call Lewy body dementia, where it is, your perception is not there. You don't do things very well. You can't walk properly. You see little things on the ground and you feel there's a big object and you want to step over that object. But most common feature of all these dementias is memory loss. It doesn't matter which dementia you have, but it's memory loss. So the Alzheimer's disease is the most common form of dementia, as I said, and 50 million people globally, all that we said again, so I don't want to go repeat that, but women account for 2/3 of those. So the societal damage, the estimate is a lot. In 2010, the cost to this community, to society, was $6.4 million US, and in 2021, it's going to jump up to 1 trillion. Who knows now with COVID what it will jump to? I have no idea. And the rising global cost of dementia will pose serious challenges to healthcare and social care systems around the world. So we have to be very, very cognizant of that fact. The monetary cost for estimates in US is treatment cost is, in 2018, it was $290 billion. In 2050, it will be 1 trillion. The healthcare costs is individual costs for the healthcare system, the public healthcare system, and your private healthcare system. And the family caregivers, unpaid hours of care, which we give, in 2011, it was 11.5 million hours. And in 2015, it will be 38.4 million hours, because there are more and more people having dementia, more and more family members have to give it. And who are the family members who give it? It's the spouse who gives it. It's about 46%. And the average age of the spouse themselves is high, it's 74 years. And some of them are still employed. The adult child has to also be involved, 44%. And average age of the adult child is 54. So they are also having their own problems, their own health problems, their own social problems. And on top of that, they have to care for their elderly parents. And who is the adult child? It's only the daughter. 71% is usually the daughter. And sometimes they go and live in the same household as their parent. And 71% of these hours are supplied by women. And sometimes friends and neighbors give it some time off, which is about 9%. So, I mean, we have enough time. So the stages of Alzheimer's disease, it starts in a very mild form. As I said, it's a very insidious progress. So the mild to moderate stage may last for about 2 to 10 years. It starts with being forgetful about recent events. You have difficulty with complex tasks. You don't know how to do it. Then another thing which is very annoying to the caregiver is that you become suspicious. And you become more suspicious of people who are with you. Those people who are taking care of you, you become more suspicious of them. If you put something somewhere and you forget it and you think that somebody has stolen it. Either you blame your daughter or your spouse or the person who's looking after you. Something, the suspicion is there all the time. But at the same time, at the mild stages, there's normal physical examination. There's nothing abnormal about your physical. You're quite healthy, you eat well, you sleep well, but you have all these little problems. When I was beginning to start my career in this field, when somebody came to me with saying that you have dementia, how long should you think it will last? I was not able to tell them how long. But now, with more developments, with more research, with more services being provided for their families, and daycare services, people can live longer and have better quality of life. and better quality of life and better length of life. So now after 2 to 10 years, sometimes it's earlier, sometimes it's later, the stage develops into a moderate stage. Now the same problems which are there becomes more pronounced. You have more difficulty cooking. You keep cooking the same recipes again. Keep cooking, put more salt. If you keep forgetting that you already put the salt and you mess up the whole thing. You have more difficulty handling money. You go out with some change, what the people give you back the change, you don't count, and you come back with less change. You're unable to maintain a home. When I used to go and visit home visits, the home of people sometimes with dementia would be so untidy. There'd be so many papers and books and things all cluttered up that I would come home and clean up my home, thinking that I hope nobody comes to visit my home to see how untidy it is. So unable to maintain home is there. The difficulty to manage medications. You have a box for your pill box, but you forget that whether you took the pill or you didn't take the pill, or what happens. And so it's sometimes you take too many pills, you take again and again, or sometimes you don't go 1 or 2 days without taking the pills. So there's difficulty in managing your medication. So that is why if somebody is there with you in the house, they will help you. And there's little recall for recent events. We ask them, where did you go? Or they're just stepping out of the bus from visiting a park, and you say, nowhere, I didn't go anywhere. But then sometimes you have your family members in the nursing home and you ask them, did anybody visit you today? And you know that somebody came to visit. No, nobody has come to visit me. I have been here all alone all the time, you know. So there's no recall of what is happening. Recall of recent events is not there. And at this stage, the person begins to become agitated and they become aggressive. So there's behavioral problems start in the moderate stage. When you're in the early stages, there's only a little bit of suspicion, but there's no aggression. There's no agitation. In aggression, the people can hit you, they can scratch you, can do all sorts of things. A scream at you, that is also bad. They become agitated, they keep banging, screaming, wanting things, insisting. In the later stages, the last stage, which is a severe stage, they can last about 1 to 2 years. And there they have difficulty dressing themselves. They cannot button themselves. The buttons are all upside down. They have difficulty swallowing because the construction's there. So the food has to be made into more pureed and more softer food has to be given. Now, at this stage, beginning to have fecal incontinence. And as I said, it is the reverse of this child. The child loses his learns the urinary continence and then fecal continence. Here, the fecal continence is first to come in. Then you have your urinary incontinence. There is a gait disturbance. The person cannot walk. There's more shuffling of the feet. They cannot walk very straight. And so the balance is not there also. Then you begin to have hallucinations. They begin to see things and they have delusions. And then there's a poor recognition of the family. They cannot recognize their people in their family who are the newest additions. They may remember their husbands, spouses, or their siblings, but they cannot, sometimes they mix up their children with their siblings. They mix up their grandchildren, are totally lost. There's nobody, they can't remember the grandchildren. So the recognition of the family is not there. So what we used to do, and sometimes when you have any family members, you put the pictures of their selves when they were younger, so that they remember themselves as younger much more than what they remember themselves as older. When we look at the mirror, sometimes when you say, oh my God, is this how I look now? You know, and you forget what you used to look. So that you try to bring back their memories. There's little recall of the past life. As I said, vocabulary is very restricted. Enough words don't come out, so they don't make a complete sentence. So you have to guess what they're saying. You have to get into their frame of mind to know what they want to talk about. And at this time, here you get your neurological abnormalities. They have this grasp reflex, all the reflexes which the children used to have, like the sucking reflex. When you took the milk bottle close to it, it will open its mouth to suck. The same thing with the adults over here. They have the sucking reflex. They try to put everything in their mouths and whatever. So that's another abnormalities which we see in the late stages. So here is this is a healthy brain, you can see, and you can see in severe Alzheimer's, all the parts are gone and you have little holes all over the place. And can you see the healthy brain here? It's supposed to be this one, and the shrunk brain. Okay, so what are the risk factors for Alzheimer's disease? Age, genetic factors, and environment. Okay, age, we cannot control age. We all age. So, and there is changes taking place with aging. And there are brain cells are lost every 10 years. And the brain ages after age 30. But the brain cell loss is so minimal that we don't see any, it doesn't make any difference. But as we grow older, then more and more brain cells are lost. And by the time you're, say, you lose about 60 to 80% of your brain cells, there is a diagnosis of dementia, the diagnosis of Alzheimer's disease. But if you lived up to, if you lived up to 100, then 80% of your brain cells will be lost. But there's still people with 100. Now, I mean, doesn't mean that everybody who lives up to 80 will have all this damage, and everybody who's 100 will lose their brain cells and then they have dementia. It is not a size fits all. You know, there's a difference. Now, genetic factors are another. We cannot control our age. We cannot control our genetic factors. So those two factors are there, and those this is there. And if you have a defect on chromosome 1 in your genetic factor, there's less than 1% chance of developing the Alzheimer's disease. If you have it on 14, there's a 4% chance, and there are about 400 families in the whole world which have this. And there, in this, when you have a defect on this chromosome 14, this disease starts very early. It starts, I've seen people as young as 28 to in the age range of 28 to 50. And it's very sad. I had a family, a Scottish family, and she was the 5th in the row of 11 children. And everybody above her had already had the disease, and everybody below her were beginning to show the disease. And she had, and people, the good part of it is that when it starts early, they tend to die earlier. When you have it on chromosome 19, which is ApoE4 form of it, and that usually happens when you have 2 allies of that, it happens with boxers. And if boxers who have 2 of this, they have blows to their head, then they begin to have dementia. And chromosome 21 is less, and this is the most common form of dementia, 19. And 21 is the Down syndrome. People with Down syndrome who have this, and if they live up to age 60, they'll definitely have dementia. Environment. Now, I'm saying education is not a risk factor. It's not that the lower levels of education, people who have low levels of education are going to get the disease, but it means that if you're lower level of education, you're you have a lower socioeconomic status, you tend to have a lower financial status, so you eat less good food, your diet is poor, so that in a way, that is an indirect result of education on your risk, it's a risk factor. Then hormones, we have hormones which help you maintain your body. And if you have, your hormones are out of balance, there's another risk factor. Then head trauma, as I said, boxers with trauma on your brains. Our brain is so fragile, it's encrusted in this shell. And so anytime, it's like a jello, and anytime it shakes, it helps. So accidents, concussions, any brain damage, all that causes dementia. Hypertension, which causes, as I said, is vascular problems, and then Down syndromes. These are all environment factors. Now, what are the protective factors? How can we protect our brain, and how can we protect our memory? Higher education. Higher education does not mean, it means that you begin to learn to have better coping strategies. If you forget something, you tend to find a little way of remembering things. If you try to do something else to be able to cope with your failing memory. Estrogen stimulates the release of natural compounds in the brain cells. Exercise, as I said, is a very good protective factor. Anti-inflammatory or hypertensive drugs are good. Antioxidants, vitamin E, B, and C are good as supplements. Red wine, and that's a good thing, not white wine, because the mold on the skin of the red wine acts as an antioxidant, and that antioxidant is as a protective factor for your brain. Then cholesterol lowering drugs, good diet, as we saw that before, social support and network is a protective factor, and spirituality. We have to believe in something and be spiritual. Now, what is the treatments? Are there any treatments? The first treatment which we found, it is not really a treatment which just slows the disease down. It was approved in 1997. And since then, the last one was approved in 2003. And since then, we've not had anything which is be able to, even lately, something came up quite well, but it was stopped because it was not showing any results. And all the work which we did was gone, finished. We had Aricept, you must have heard of, Exelon, Reminal, Ebixa. These are all approved for till 2003. And so people work around with these combination of these drugs to be able to slow down the thing. As I mentioned before, dementia is not only cognitive loss, it's not only memory, but it's non-cognitive, it's psychiatric and behavioral losses. Agitation, wandering around, they leave the house, they can't find the way back, vocalization, they keep talking and they non-stop, they become aggressive, and there's between 43 to 93% of the people have these symptoms. Can I go on for just a couple of minutes more? Is it okay?
Yeah, right? Yes.
Okay, just a few minutes more. Okay, so what sort of behavioral problems? You have to be physically non-aggressive behavior. You're pacing, inappropriate dressing, trying to handling things inappropriately. You have physically aggressive behavior. When you ask them to do something, they hit you, they kick you, they push you, they scratch you, they grab people, they spit on your people. So, I mean, the people who work with the people with dementia have to be really very dedicated. Then you can have verbally non-aggressive behavior. They're constantly complaining and complaining and complaining, and they have negative, they are screaming, they're repetitive, irrelevant interruptions. And then you have the verbally aggressive behavior where you're screaming and they curse you and they have temper outbursts and they throw things at you and they're making strange noises. So it becomes very annoying. So people, if you have relatives who are there and you have to know what is your capacity, your own capacity, the caregiver's capacity to be able to look after all this behavior. At what point are you going to say, enough is enough, I can't manage? They have to be placed, or they have to be looked after in a nursing home. So that depends on each individual. Some people have unlimited capacity and they have very good relations and they will do things and they have a very good social support from their own siblings or their own relatives or the neighbors or friends, and some have nothing. So they go around to placing them in nursing homes much earlier. So what are the management behavior problems that you can manage? There's restlessness, you have to distract them. The most important thing over here is you never contradict the person because you'll never win. They think they're always right. We have to cooperate with them, but not contradict them. Restlessness is there, repeated actions, and if the behavior does not bother you, just leave it. And there's a suspicion. Provide comfort and do not argue or try to reason that nobody has taken it away. No, 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 it's all in your mind. That doesn't work. That doesn't help. And so the behavioral disturbance can be primary behavior, secondary behavior. Primary is sleep problems, sundowning. When it comes to evening time, they begin to be restless. They want to go out, and the night becomes day. Then they become hoarding. You find in the drawers of these people, all little bits of pieces of paper, all little things are hoarded there. They just pick up things and put it there. They become restless, and there's physical aggression. There's primary behavior. And the secondary is medical conditions. Sometimes they have a pain, sometimes they have fecal impaction, they have a fractured tooth or congestive heart failure, which hypoglycemia, we don't know. And unless they are being medically treated or there's a good physician in the place to look after them, the secondary behaviors just keep going. What are the intervention techniques? Non-medical treatments, music therapy, art therapy, movement therapy, exercise, cognitive activities. Helpful. Okay, so the challenges in behavior are different. In early stages is just difficulty in understanding. They don't understand humor, they don't understand, and what they say is a bit more embarrassing. But in the middle stages, the difficult behavior is more physical behavior because you have to really work with them. You have to sometimes lift them up. You have to understand the conversation. As they speak you don't understand what they're saying. Reading and everything is different. And the late stages, you lose the capacity of recognizable speech. You're unable to understand what you are saying. You don't understand what they are saying. First of all, they don't say anything. It's just mumbling words coming out, and language does not make any sense at all. And at this time, non-verbal communication becomes very difficult. very important. Not only difficult becomes important. You have to be able to connect with them somehow. And you can connect with them somehow only by touching them. Touch is something which they can respond to. If you just keep speaking, it's not going to go into the ears, they're not going to understand, but touch they can respond to. Okay, touch, smell, vision, and hearing. You can hold hands, massage gently to hands and legs, and smell, give them a favorite perfume which they know, a flower, or food. Some in our hospitals, we used to have a cooking class over there. So the food, the aroma from the food, the cooking would bring back memories of their childhood, or memories, good memories. Videos, visions of scenes, of nature, calming sound, comforting. Even if words are not understood, music is very soothing. Hearing, tone, voice can maybe soothing. The more, when you get excited and when you shout, the patient gets more shouting. The person gets more excited. When you keep a calm and you're quiet, that gives you comfort. So the most important strategies is connect and not correct. You don't have to correct them for whatever they're saying is wrong, but you have to try and connect with them and try to understand what they're trying to tell you. Okay? So, is there any questions? If you want to say who are the caregivers, the informal caregivers, formal caregivers, some people provide 24-hour care, 7 days a week, it's round-the-clock care, and caregiving tasks can be very important. And the pressures of caregiving. So this, I would just want to touch on this, that caregiving is a very stressful job. And you have a lot of stress when giving them. And what is stress? It's a biological reaction to the physical danger, what's going on. There can be an acute stress, which is good and sometimes necessary, and there can be a chronic stress, which means it's not good and it keeps going on and on and on. And that's chronic stress accelerates your aging process of the caregiver. And so the stress is experienced as physical stress. You can have headaches, fatigue, loss of appetite, sleep disturbance. You can have a mental stress. You have impaired memory, loss of concentration, inability to make decisions. You have emotional stress, where you become tense, nervous, you become frustrated, depressed, anxious, and behavior stress. You start smoking, drinking, overeating, nail biting, swearing. All those are behavioral manifestations of stress. These are all the manifestations of stress. And what are the signs for caregiving stress? When you deny that there's a problem, and you feel angry with the person to whom you're giving care, and you can't express that anger, then you start withdrawing socially. You don't want to go anywhere. You become anxious. You become depressed. You become exhausted. There's sleeplessness. You don't sleep the whole night. There's emotional lability. You feel angry with the patient. You feel sorry for the person. There's a lack of concentration, and then you neglect your own health problems. And how to avoid stress? You have to learn about the disease, to be realistic about the disease. Be realistic about what you're capable of doing yourself. Don't try to take on all the responsibilities, because we are not superhuman beings. We need some help ourselves. We have to accept our feelings of, sometimes you feel angry with the person, sometimes you feel guilty, sometimes you feel like hitting that person, but you have to accept those feelings and share those feelings with others. Share it with your siblings, or share it with your whatever, whoever is next to you. But at the same time, be positive that, yes, I have to do this, and look for humor. Even in the smallest, stupidest thing, there's some humor. Take care of yourself. Get help. Plan for the future. Look for the future, and don't just live in the present time, but think that, yes, things will improve, things will change, things will become better. Change the way you look at things. Take nutritional health seriously. Exercise, one of the best and most efficient ways to reduce stress. Practice relaxation and meditation. Get more sleep. Buy yourself some relief. Hire help. Over here, if you want to be looking after your driveway, or you have to clean your grass, so you contract out your work so that your job becomes a bit easier. Book a massage for yourself once in a while. Pace yourself. Don't try to do everything together. Don't try to overextend yourself and say, yes, I can do it. We women are very easy to say yes to everything, you know. I mean, you have to build yourself a support system so that people are there to help you. The first step in reducing stress is to take back control of your life. Don't let the patient control your life. You have to control your own life. I'm using the word patient, but it's your caregiver, your loved one, to whom you're giving your care to. So you have to learn to control your life. So getting old is natural. We all have to get old, but feeling old is optional. And by staying well and doing all the things we've suggested, exercise, diet, keep your brain active, we will stay as long as possible, stay mentally young as long as possible. So thank you. We managed to finish.
Thank you very much. Am I unmuted, Rustam? So the question, are you ready for the questions?
Yeah, sure.
Okay, the question 1 is, can an MRI diagnose dementia?
Well, much better than before. MRI will tell you that where the problems are lying, but which time? Yeah, it can. It can.
Yes.
Yes. But don't use the word just dementia. You have to have a proper which part of which dementia which you can diagnose. It can diagnose Alzheimer's disease much better than other diseases.
We told.
Okay. Question 2 is, what is the I think you talked about it. What is the difference between Alzheimer's and dementia? Do the two items describe some symptoms?
Yeah. Dementia, as I said, is a global term under which you have different types of symptoms, different types of diseases. You have, as I said, the vascular dementia. You have 64 different varieties, but the most varieties which you see is Alzheimer's disease. Then you see vascular dementia. Then you see the Pick's disease. You see the Lewy body disease. There are some 5 or 6 types of dementias which you see more often than the others. So, and the symptoms, as I said, in all of them, the major symptom is memory loss.
Okay, question 3. Are you speaking about Broca's versus Wernicke's areas of brain?
Yeah, but I mean, Broca's is the language part and the speech part. So it affects, in dementia, all the parts in the end are affected. Everything is affected in the end. It starts with the specific memory center, and then it spreads to all the other regions of the brain. It goes to Broca's, it goes to Wernicke's, it goes to all the regions.
Okay. Now, why is dementia projected to rise? What is the cause of this projected rise?
There are several reasons. The one is that we are all living longer, and this is more an age-related disease. So the longer we live, the greater the chances are that more of us will get the disease. The second is it's becoming more known. Before, if somebody, my grandfather died in 92, 93, he had the same, now I know that he had the same symptoms as what we had for a severe stage of dementia. But we all thought that that's all aging. It's all a part of the aging process. Nobody put the diagnosis to that. It's only now in 1903 when Dr. Alzheimer found the cause of this, and we put a name to the symptoms, then we started calling it Alzheimer's disease.
Okay. Research is finding links between high sugar and carbohydrates with very little good fats consumption in our modern lifestyle with increasing rates of dementia, autism, etc. globally. Can you please elaborate on that?
Well, they say that diabetes is considered to be the 4th cause of dementia, because diabetes, the blood sugar, which is high, the blood sugar, and it hinders the circulation in the brain, and it doesn't irrigate your brain very well, and that causes a spikes in your sugar. So when you have very high sugar, you feel giddy, or whatever, and when you have low sugar, you feel like collapsing. So the sugar is, what should I say? It doesn't stabilize your brain to function at its optimal. Unless you control your brain sugar, your brain goes up and down. Your brain functioning is not stabilized. So diabetes is a very important aspect, a very important 4th cause for brain damage.
Is the medication Prevagen and Nuriva good for preserving memory?
I don't know. I mean, I see that on the television all the time, but I don't know how good it is. I cannot answer that.
I think Mr. Pantaki has a question. Is that right? You can unmute yourself and ask a question. And on the right-hand side.
No, I don't think so. I don't think he has a
Yeah, I see.
Oh, you don't have a question?
no.
Okay, no problem.
Thank you.
I have a question.
Okay, sure.
Dolly,
Yeah.
I'm just wondering why people with Alzheimer's remember very old things very well. For example, we went to visit a friend, and when we were talking about what happened today, he couldn't remember anything.
Yeah.
But then we started talking about growing up in Dadar and went to that school. He remembered the names of the teachers. He remembered everything.
Yeah, because that is how our memory is constructed. If you think of it like a hourglass, what you put on the top and from the hourglass, it sinks to the bottom. So whatever is there from the beginning will remember it much more than what is coming from the very top. So that is why this is it's a good question that you ask, because people will remember things what happened in the school. If they had two wives, they'll remember their first wife, they'll remember the other children, but they will not remember the recent things. What they ate, they wouldn't remember. What they happened that day, they won't remember. What they happened 20 years ago, 50 years ago, they'll remember it much more. That is how the memory is made. Your past, your long-term memory is there much stronger than your short-term memory. And I told you that there are differences. From the short term, it has to go into the long term. Now, if you have consolidated that memory in your long term, it stays there.
Dolly, Rustam here.
Does that answer your question?
Oh, sorry.
Yes, yes, very well. Thank you.
Dolly, quick question. I know that Parsis tend to live longer than the average lifespan. Do Parsis have any more incidences of dementia or Alzheimer's?
From what I mean, I don't have statistics, but I know that we do have a lot of problems. We do have a lot of problems. And that is why I've been talking about that even when I was in Bombay. And I kept telling them that we have to think about that our people, old elderly, are living alone in their big homes. They're living, there's no activity for them. There's no social support for them. And we have no proper homes, nursing homes where these people can go to. Here, at least you have some. If you pay, you can go to a nursing home. But there, even if you pay, there's nothing to go to in Bombay. So, which is a tragedy. And there are people. We are living longer. We live longer, and we have a lot of problems. And nobody's doing anything about it. And WZCC, even in Chicago, in Toronto, not Toronto, in New York, when I talked about it, I said the WZCC should, even in Canada, in here, we should start thinking about it. Especially in India, especially in Bombay. At least in Navsari, they have a home where somebody can go to, but people from Bombay are not going to go to Navsari to live there.
Yeah, thank you.
Thank you. Any other questions?
This is Khurshid. I have one quick question.
Okay.
So when we're talking about short-term and long-term memory, in between you have what's called working memory, which kind of falls under short-term, but is also sort of the bridge to long-term, if I'm correct. And so I was just wondering how working memory is also impacted, because short-term memory also has several compartments, correct?
Working memory and short-term memory are almost identical.
Okay.
You need that memory. You need that memory to do your daily work. And it may be a little bit more than the short-term memory because you're using it more often. So you're making more use of that short-term memory.
Then can you repeat?
But it is the same thing. It's the same thing.
It's fine.
One more question here. Are caregivers more prone to dementia?
No, caregivers are not necessarily more prone to dementia, but the caregivers are more prone to depression. They're more prone to not looking after their own health. And so they have poor health. And if they have poor health and they have poor depression, what happens is that their concentration may not be so good, and they begin to act as if they are losing their memory. But they're not really, the memory is not really affected. It's their depression which is causing them to be not functioning well. And when that stress or that pressure is taken away from the caregiver, when the person dies or the person is placed in a nursing home, when there's not that daily stress is not there, then the pressure is off, and the person begins to recuperate or recover a little bit.
One more question, Dolly.
Yeah.
Following up on Rustam's question about Parsis, it's the fact that we kind of marry within our community too much. Marry kaka kaka nana mama mama na chokra panna. Does that make us more prone to Alzheimer's?
I don't know whether they make us more prone to specific Alzheimer's, but it reduces our gene pool. It makes it more, if you have a defective gene and it multiplies with another defective gene, then you're increasing the chances of getting more and more of that disease in a more pronounced way, much more than if you're marrying somebody without a completely different gene pool. If there is 2 people in your family who had dementia or Alzheimer's disease, the chances of the children getting is much stronger than if there was only one person. If only your father had it, but if your father had it and their father's family had it, all of them, then your chances are much stronger than if it's a random thing in your family. It's a different story. But if there's a genetic history of it in your family, it's much stronger. So if you're marrying somebody who also has a history, then you're doomed.
Anybody has question anymore? Okay, Dolly.
Thank you, Dolly.
Thank you very much. It was very informative and very interesting. Really all enjoyed it. So we really appreciate.
We are very
Thank you, Dolly.
Thank you so much.
Thank you.
Thanks, Dolly.
Thank you, Dolly.
Thank you.
You're very welcome.
Thank you.
Thank you.
Okay, shall I switch off?
Thank you.
Or anybody wants to ask anything?
Thank you.
I'm if anybody wants to ask anything more.
Dolly, this is the second time I heard your speech. First in Houston, of course, face to face. And I can tell you, every time I listen to it, I get more and more insight into what you're trying to convey. Thank you.
And every time I make the same speech, I think something different comes out of my mouth.
Must be. It must be. Thank you.
I have a question. Can I ask you a question?
Yeah,
Shelly.
sure.
Should you get your memory I'm 41, going to be 42. Should I get my memory tested? I've had it tested before, but I find it really going down.
Is there any genetics?
No, nothing.
Do you personally have any problems? Yeah, I think you can get, you should get yourself tested and periodically tested, say every year, to see what's happening. Are you stable, or is it going down, or are you maintaining your own? But at the same time, if you're worried, you have to do a few things which I just mentioned. You have to do with your exercises, you have to do good your diet, you have to keep your brain active, you have to do things, be socially active, so that your brain, you have to keep your brain engaged.
Is it almost worth it to get tested though, or is it just better not to get tested and just do the things that?
Get tested. No, if you get tested, I mean, and then what will you do?
Exactly, right.
If you're going to do something about it, if there are programs, I mean, I would get yourself tested once. I would do it.
Yeah. Okay. Okay.
So
Thanks.
One question, Dolly. What is the name of that book you mentioned? Dementia?
It says Down with Dementia. Can you see it?
Yes.
Higher up.
And by who?
Put it higher. Down.
Down
with dementia.
And who's the author?
This is a young girl, Z-E-N-A-Z or Z, what do we call it? Sarkari.
Okay. Thank you.
She's from California.
Okay.
I have a question. Are these slides available at all? Do you give out the slides? Are they proprietary?
We are recording this session.
Oh, okay.
And in about 2-3 days,
Uh-huh.
we will be posting it on WZCC Universe. It's on YouTube. And some of the other sessions that WZCC has are also recorded and posted there. But this will also be posted in 2-3 days' time.
Okay.
But when you record it, you record the slides as well, or you record just my
Yeah,
speech?
the slide, whatever you are showing will also be recorded.
Okay.
I have a question, please, Dolly.
Yeah.
Can a patient improve once he or she suffers from dementia? Are there chances of improvement?
I can tell you only for Alzheimer's disease or the dementias which I normally deal with.
Yes.
Vascular dementia, it can be stabilized because if you're controlling your blood pressure, you're controlling your cholesterol, you're controlling everything else, you're doing your exercise, it can be stable for a long time. But if you are not doing all those things, you are definitely going to go down. Alzheimer's disease, as I said, when I started working, they would ask me how long. I would say 5 years, 10 years. But now with so much of social support which people are getting, so much of daycare activities where you keep your different activities are there and people can maintain their quality of life. The quality of life should be there. Your social, if you have dementia, you're living all alone, you're in a nursing home, you have no activities there, then you're definitely not going to improve. But if you have some support, your quality of life will improve and you live longer and better for a longer time. That much I can say. You're not going to get better because you're not going to get perfect back because your brain cells will keep on dying. But the rate of dying will be slower.
But are there any medications or is it only the environmental support that will improve your life?
Environmental support is most important, but as I told you, the medications which are there is not curative. They're only supportive to keep you calmer, to make your life a bit better. And there's nothing since 2003.
Okay, thank you.
Nothing is working because we are maybe barking up the wrong tree. There's something else going in the brain which we don't know.
Thank you.
Dolly? Dolly, how is vascular dementia diagnosed? So how do you know what kind of dementia you have? Is it by MRI or?
No, the vascular dementia is the easiest to diagnose because it's your vascular problems. You have a high blood pressure, you have high cholesterol, all those things. So that's much easier to develop. The other ones are there with your MRIs also. If there are more damage on the frontal lobes, the more damage in that specific part of the brain. But it's also from your different symptoms. If your behavior doesn't follow the pattern of what you normally should follow in a Alzheimer's disease, then you look at other things.
Mm-hmm.
If you're suddenly becoming very lewd, suddenly becoming very inappropriate, you're doing things out of the ordinary, then you begin to think that this must be a Lewy body disease, right, or frontal temporal dementia. We have to start looking at different things if it doesn't follow the regular pattern.
Right. So if otherwise you are okay from whatever you had mentioned, the 10 things about dementia, the semantic one where you kind of cannot think of the right word, is that, if you just have that, is that cause of concern, cause for concern?
Those 10 items, they don't have to be all there.
Okay.
You don't have to follow that sequence. It can be 1 or 2 or things. But if there's the words, the language is causing you real problems. If you really think that, my God, I just can't get the words out. I can't, my writing is looking different. I can't read what is wrong. Then you should be worried that maybe it's not only Alzheimer's, but it's something else in your language area.
Mm-hmm.
That may be causing some problems, I mean, there may not be any cure for that, but at least you know what it is.
So how will that help if you just know and there is no medication?
the same thing, it's better to be prepared to know what's happening and what your future is like, so that you can prepare for it. I mean, people also say that the same thing for when dementia, that what is the use of knowing? What is the use of treating? But by knowing earlier, the earlier the diagnosis you get, the better prepared you are, the better plans you can make for your life, the better plans you can make a will, you can look after your property. If you have some property, you can look after whatever you have to look after. But if you don't make any plans, if you don't have any diagnosis, then you just go haywire.
Right.
It's much better to have a plan and to be diagnosed earlier. Because even if there's any chance of anything happening, even if your little part of your brain is still intact, something can be done. If everything in your brain is gone, there's nothing can be done. You have to work, you have to salvage whatever is remaining in the brain to do.
Dolly, is there any common cause of death among Alzheimer patients that you can?
Most common.
What is more common cause?
You see, when they become more and more severe, what happens is all the systems stop giving up. They can't swallow. Sometimes they choke. They can't breathe very well, and that's it. Everything goes, it's gone.
Mm-hmm.
Sad, right?
Very sad.
It's very sad, really.
Very sad.
Thank you.
Thank you.
I don't want to end on this sad note. So,
sorry I asked.
So we should
there is a question here, Dolly. Are you still working?
Yeah, I'm still working. I'm still working voluntarily. I'm not being paid for what I'm working. I do a lot of volunteer work. I belong to a lot of volunteer organizations. I'm on the board of several, so that's where I'm working.
Okay.
Do we, a question, do we have statistics that how many passes, what is the population of our community that is suffering from this ailment?
I have it somewhere because Dinsha Tamboli once sent us all that census, but I don't have it off my head.
Right.
If I can find it, I'll send it to you.
Thank you.
Okay. I think, any more questions? I think otherwise we'll.
Actually, I just have a quick one. Dolly, sometimes very scholarly people who've been highly educated also have Alzheimer's. So in fact, very often, people who've really achieved a lot, they've been very active all throughout their life. Even then they get Alzheimer's. So do you have anything to say about that?
Yes. Well, what I have to say is because I worked in the same field for 40 years. So during that period, I've seen people who have been directors of hospitals. I've seen surgeons who have developed dementia. I've seen CEOs, and I've also seen little housewives who had no professional life. So it is this equalizer, this disease.
Right.
Doesn't affect this person or that person.
Yeah, even if you keep your mind active.
But the person who is more educated, the surgeon, he was able to cover up his deficit for a much longer time than somebody who had no education. He would go to do surgery and they would stop him and then he would say, oh, I have to do something, this, that, and the other. And they would sort of assist him and let him do something, but others would supervise over him. So these people can prolong themselves and cover up very well for a much longer time than somebody who has got a much less education.
Right. But the point I was trying to make was, even if you're mentally very active and you keep studying, reading, whatever, you still can succumb to that disease.
Yeah, because I said it's age and it's genetics. And if your genetic composition shows that your brain is not going to function, your brain cells are going to die at this rate for this gene which you're carrying, there's nothing you can do.
Nothing you can do about it.
You have to live each day thinking that this is your last day. I mean, not literally, but still, not if you keep People say there is genetic testing. There is genetic testing in the United States. There is. And you can get genetic testing done to see what is your probability of getting disease. But what is the use? Because even if you know, if I know today that I'm going to be demented at age whatever, there's nothing I can do to stop it. So what is my point of knowing it? You know, it's better to, as I said, it's better to know earlier so that you can plan your life, you can plan your different things, what you're going to do, but you can't cure yourself. And that is why I think recently a law has been passed, I think in the United States, saying that you are not, the insurance company cannot demand the results of your genetic testing, because then they can hype up or not give you your insurance. You know?
Dolly, there is one more question. Does a fall at an old age accelerate the onset of dementia?
The fall by itself will not accelerate dementia, but what the fall will do is will change your quality of life. If by falling, if you have surgery and if you don't have a proper, you don't have your balance, you can't walk anymore, you're confined to a bed, you're not being able to do anything, that is going to change your quality of life, and that's going to accelerate your lack of activities. That's by fall by itself is not going to cause you dementia, but the concomitants of the fall maybe accelerate that.
Okay.
Rustam, does that answer your question?
No more questions, I guess. I think we are past our time. So thank you all for coming once again. Thank you, Dolly, very much. We really enjoyed it. And good night to all of you. And I think we will just close this now.
Thank you.
Thank you.
Thank you.
Bye all.
Thank you, Nani.
Bye.
Thank you. Thank you.
Thank you, darling.
Thank you, Dolly.
Thank you
Thank
very
you.
much.
Yes.
Very nice. I
Yeah,
enjoyed
these are
today more
which
than
we
anything else.
Yeah.
I enjoyed today's. And then after,
Turn it off.
just turn it off to make it.